Thank you for joining us, the 47th Annual AAKP National Patient Meeting. My name is David Rodriguez, and I am an AAKP Board of Director, a member of the Executive Committee, and an AAKP Ambassador for the state of Texas. I'm also a kidney patient. I have experienced hemodialysis, and I have been blessed with a kidney transplant for the last 11 years. And more recently, I received a liver transplant in January 2022. Throughout my professional career, I was a former patient relationship specialist at University Transplant Institute in San Antonio, Texas. I currently serve as an appointed member of the Scientific Registry of Transplant Recipients, Patient and Family Advisory Committee, and have participated in several industry-related projects to review clinical trial design and patient education content on behalf of the AAKP. I have also had the honor of authoring a patient voice editorial in the clinical journal of the American Society of Nephrology titled Kidney Disease Burden and Kidney Transplantation, A True Story. My journey with kidney disease began in 2008 when I was diagnosed with FSGS. It was a difficult time in my life, as I already watched my father battle kidney disease. However, knowing that others in the Hispanic culture, like me, are also at higher risk, I choose to dedicate my advocacy work over the last 14 years to helping patients. This is why I am so pleased to moderate today's session on Conversation Starters: How to Have Effective Dialogue with Your Healthcare Team, as it's a topic that I am very passionate about. Skillful communication is essential to healthcare. Clear, honest communication between a patient and a provider paves the way for accurate diagnosis, and most importantly, shared decisions on making treatment options that are aligned with the patient's life goals and aspirations. In addition, every person deserves to understand the medical care they receive and the need to apply culturally responsive measures to bridge communication gaps is so important. Through the AAKP Center for Patient Engagement and Advocacy and Center for Patient Research and Education, the association is dedicated to engaging and training kidney patients in a way that are the most effective at elevating the patient voice and providing practical skills they can implement throughout their kidney journey. And today's session does exactly that. We are honored to have two excellent speakers with us that will share both the provider and the patient perspective on this topic. First, I'd like to welcome Dr. Catherine Tuttle, a clinical professor in the Division of Nephrology at Washington University, Executive Director for Research at Providence Healthcare, and Regional Co-Principal Investigator at the Institute of Translational Health Sciences. Dr. Tuttle, I turn it over to you.
Well, hello, and thank you, Dave, for the kind introduction. I'm really pleased to be with you to talk about conversation starters, how to have an effective dialogue with your healthcare team. And I'm coming to this conversation representing the healthcare provider. I'm a nephrologist and an endocrinologist, a professor of medicine at the University of Washington, and executive director for research at Providence Healthcare. However, I've always maintained an active clinical practice. Every week I see patients in the clinic. So this is a concept that is really near and dear to my heart. And I'd like to start off by saying that we really need to have a partnership in care. And it's not an us or them endeavor. It's really a partnership. And I think as a healthcare professional, it's important for us to realize and for our patients to realize that everybody has something. Even their healthcare provider in another context is a patient. And we need to come together with that kind of attitude in order to address the concerns that they have. I think with regard to visits with your healthcare professional, it is important to come prepared for that visit so that we can have an effective conversation. Have your questions ready or your concerns so that in the time that we have together, we can really spend it dealing with the issues that are most important to you. Because in that moment, when you are the patient, and in this case, I am the provider, it really is all about you. This is your time. So come prepared so that we can use it wisely and address the issues that are important to you. And that's really part of a bigger picture of being activated in your care. Because coming to the clinic or wherever you get your health care is just a small part of what it takes to manage kidney disease on a daily basis. And use this as a galvanizing moment then to leave the clinic thinking about what you can do next and what you can do for yourself. That empowerment piece is really important. So of course, if you take medicines, you can take your medicines on time and correctly, but also don't forget about the importance of healthy lifestyle and things that you have complete control over, like your physical activity, your healthy diet, weight management. If you smoke, ways to think about stopping smoking. These are all things you can do for yourself. And one of the really fabulous things about healthy lifestyle is it's something that you have complete control over. And it is so important that any medication is layered on the foundation of healthy lifestyle. Anything you take is going to work better, be more effective, and have fewer side effects if you're also doing your part to take good care of yourself. And then it's important to be consistent in what you do and to follow up with your appointments and to be rechecked. With kidney disease, so much of how we can assess your condition is in the lab work. Get your lab work done ahead of that visit so that when you go to talk to your healthcare professional, you can review those results together and really understand where you are and how you're doing. It's important for the provider to make decisions or recommendations to you about your medical treatment. And it's important to you to get feedback on how you're doing. And if you're doing well, keep doing it. If there's something awry, it gives you a chance to make a course correction. And then I guess I'll wrap up by saying that back to my original theme, we're really all patients and we benefit from peer support. So take advantage of AAKP and perhaps other peer groups that you're involved in to reach out to other people who are having a similar experience, walking down the kidney disease journey just like you are. There are times when we all need a little support, and there are people there who are ready to help you, to guide you, to show you that it's possible to get through this and do well. And on another occasion, you'll reach out and do the same for someone else. And building a sense of community is also really essential to hopefulness and looking forward to enjoying life for all it has to offer and to live well with kidney disease. So with that, I'll stop. I thank you and hope that you have a great partnership and we're all in this together.
Thank you, Dr. Tuttle, for that insightful presentation. I'd now like to welcome a dear friend and a fellow AAKP board member, Ms. Jennifer Jones. Jennifer is a retired Marine veteran, a member of both the AAKP National Board of Directors and Executive Committee, and an AAKP National Ambassador. Jennifer joins us to share the patient perspective on effective dialogue with your healthcare team. Jennifer, welcome.
Hello. I want to thank AAKP for graciously extending the opportunity for me to discuss such an important subject, how to have an effective dialogue with your healthcare team. I am sharing a strategy with you that has greatly helped me throughout my kidney disease journey to feel seen and heard and be the lead of the decision-making process for my care. I must disclose that I did have an advantage in the beginning. My mom, Christine, was a nurse for over 35 years, so I have a lifetime of experience communicating with a healthcare professional. If anything appeared out of the ordinary with me, she would put on her nursing cap, figuratively, and go into triage mode, checking my vitals and wanting to know my symptoms to determine what was going on, no matter how cringe and embarrassing it may be to a teenage girl. However, I am immensely grateful that she prepared me and still provides guidance for me to be able to effectively communicate with my healthcare team. I am aware that this is a privilege many do not have, so I get how overwhelming it can feel to be in a position where you aren't quite sure what to do on top of receiving a life-changing diagnosis such as chronic kidney disease. It's a surprise that alongside a diagnosis, you receive an entire healthcare team for the duration of your care and treatment as well. We know that each member of your team is responsible for certain areas of your care to ensure that all of your needs are met. Now, while they are the subject matter experts of your specialties, you are the subject matter expert of you. You are the focal point of your healthcare team. And the goal is for you to engage together in shared decision making when it comes to treatments and care. Shared decision making involves sharing with your healthcare team your unique values, preferences, and cultural beliefs and practices that may affect your medical decision making. Only you know how you are feeling, what is going on in your body, what symptoms you are experiencing, and whether or not you are receiving the care that you believe is most beneficial to you. Your healthcare team can provide the best care if they fully understand what is important to you and where you're coming from, especially in regard to treatment choices and your willingness to follow through with medical recommendations. Studies have shown that patients will more likely experience better health when they and clinicians reach decisions that are based on the best clinical evidence, are consistent with patient values, are mutually agreed upon, and are feasible to implement. Establishing effective dialogue coincides with establishing a relationship between you and your healthcare team. This is a relationship where you are trusting your healthcare team with your life for the most part, and your healthcare team is trusting you to follow through with all agreed upon treatment and care, and to be honest and upfront about how well you're adhering to the treatment. I want you to take time and ask yourself, what kind of relationship do I want with my healthcare team? Now, I place the asterisk there because I'm aware that many of you were probably thrown into your diagnosis unexpectedly or have been with the same healthcare team for years. But this question can be asked no matter where you are in this kidney disease journey. It can be also used as an assessment or reevaluation of your current healthcare team. Here are some deeper questions to help you get started. Do you want shared decision making in which your voice will be heard in all healthcare decisions? Should the members of your healthcare team be empathetic, knowledgeable, listen to your concerns, explain medical concepts clearly and in lay terms, and spends as much time as necessary during appointments? And, well, what will you not tolerate from your healthcare team? For example, if you encounter a healthcare professional who makes you feel rushed through your appointment or exclaims visible frustration when you ask questions. Establishing your preferences and non-negotiables for the relationship that you develop with your healthcare team can establish trust. It enhances cooperation, and they will be able to better understand your unique needs and provide you with the care and treatment that you deserve. Don't be afraid to share this with your healthcare team. There is a common saying amongst patients that you are your own best advocate, but what does that really mean? Patient self-advocacy is defined as representing one's own interests within the healthcare decision-making process. Engaging in patient self-advocacy is advantageous for the patients receiving medical advice or care because patients with self-advocacy skills are able to approach physicians with more confidence, adaptability, and with less uncertainty. So in other words, advocating for yourself means increasing your health literacy by seeking knowledge that is relevant to your condition in order to participate in your own healthcare decisions. Being assertive in initiating healthcare topics and asking questions, knowing your rights as a patient, communicating with those around you about the help and support that you need. Having the confidence and ability to make the choices that are right for you, and to have the ability to practice mindful adherence, which is being able to challenge the treatments offered by healthcare professionals if they do not suit your needs, or if the treatments are inadequate. For example, if you believe that you're receiving inadequate treatment, you can request to explore other alternative treatments that may better suit your needs. When you step up as your own advocate in a healthcare setting, you send a clear message to your team that you care about your health and are invested in getting good quality care as the patient consumer. The foundation of self-advocacy is health literacy, which is the degree to which a person can obtain, process, and understand the basic health information and services they need to make the most appropriate and best health decisions. I can't emphasize enough that increasing your health literacy must be at the top of your responsibilities as a self-advocate, because achieving effective dialogue with your healthcare team requires you to have at least a basic understanding of the jargon surrounding your diagnosis, the medical terminology used for your lab work and treatment options, and the ability to do your own research about your diagnosis and treatment modalities. The Agency for Healthcare Research and Quality discovered that it has been estimated that only 12% of US adults have the health literacy skills needed to manage the demands of our complex healthcare system. There is a major discrepancy between the health information people receive and what they're able to fully understand. So, why is that? As important as it is for us as patients to be able to effectively communicate with our healthcare team, it is equally important for your healthcare team to be skilled in and committed to providing the education and support we need to understand our diagnosis and treatment decisions. There are many barriers that patients face, and I would like to acknowledge a few of them. Patients may worry about whether to trust what they are being told, but may not share these concerns or feel that they cannot question the healthcare professional. When patients are feeling unwell, afraid, or tired, it can be challenging to fully process the information given by the healthcare team, especially when the information can seem very complex at times. Differences between provider and the patient. Studies indicate that culturally diverse patients are more likely to experience multiple health disparities in access to care, communication with healthcare providers, and medical quality of care and outcomes. And the patient may have feelings of embarrassment or shame about their competency and or language proficiency. So what can you do as your own advocate to increase your health literacy despite these barriers? First, knowing what kind of relationship you want with your healthcare team. Ask all of the questions you need to understand your diagnosis, treatment, and desired outcomes. Never stop asking questions throughout your entire kidney disease journey. Please remember that you can ask more than one healthcare professional the same question. If you ask someone a question and aren't satisfied with the answer, ask someone else. It's okay to get a second opinion. A second opinion can be beneficial due to receiving new information to help with decision making, or alternatively, if no new information is learned, you can feel more assured in the initial diagnosis or treatment suggested. Take the initiative to share your unique values, preferences, cultural beliefs, and practices that may affect your medical decision making. Sometimes there is an assumption that the healthcare professionals should know how important something is, or they should be the ones to bring something up. So patients may feel like this isn't their responsibility. I would argue that just like we desire that our healthcare team look at us as human, we remember that they are human as well. Remember that you are the subject matter expert of you. So you are the one who dictates what is deemed important to know in regards to your healthcare. And remember that it is normal to feel embarrassed or ashamed while discussing such invasive topics. Please don't hesitate to share your feelings with your healthcare team. While it is the responsibility of your healthcare team to provide the education and support you need to understand the illness and treatment decisions, it is your responsibility to effectively communicate to them as clearly as you can. When preparing for a visit with a member of your healthcare team, strategize ahead of time about how to advocate for yourself. This can help you get what you need from the appointment and get the most appropriate care. If you don't have to get blood drawn, consider having a telehealth visit, since this may be a more comfortable and convenient option for you. I recommend dedicating a notebook to document everything related to your healthcare so that your concerns, symptoms, questions, and answers are all in the same place. For those who are digitally savvy, you can also use a free note-taking app like Evernote. Be sure to record what has happened since your last appointment, any new symptoms or changes in your appetite, weight, sleep, or in the medications you take. Have questions prepared in advance. Creating a list of questions will better prepare you for the discussion between you and your healthcare team. It'll help you address the most pertinent concerns when time is limited and will increase your health literacy, which in turn will make you a better self-advocate. Conduct your own research and information gathering about your diagnosis, medications, and any treatments discussed in prior appointments. Have copies ready to give to your healthcare professional or send via email if possible. Mental preparation is also important. Be ready to discuss the things that make you uncomfortable, new symptoms, discomfort, pain, and any uncertainties. And also be ready to answer the routine questions that your healthcare team asks at every appointment. For example, how has your blood pressure been? That's a common question. If possible, bring someone to your appointment with you, regardless if it's in person or via telehealth. Beforehand, discuss with them how you would like for them to support you. Share with them how you really feel, what your concerns and questions are, and if you would like for them to take notes for you or remind you of anything that you may have forgotten. If you are unable to have someone with you in person due to COVID restrictions or for some other reason, you can still have someone listen in on your appointment via the phone. For example, my mom and I live in different states. So when I have told my healthcare provider that I was going to have her on the line to listen in, I have never had anyone object to that. You can also request if it would be possible for you to record your appointment if you have the capabilities to do so. Right. So you know what kind of relationship you would like to have with your healthcare team. You understand what it means to advocate for yourself. So now I want to share with you some helpful tips that will help you maintain an effective dialogue during your appointment. Do your best to stay focused. I know that may be a challenge at times, but do your best. Ask for an interpreter if needed. Ask your prepared questions at the start or near the start of the visit. Make sure to communicate with your healthcare professional about all of your concerns. It's okay to interrupt or to correct them if they have misheard you. Remember our recurring theme. You are the subject matter expert of you. Ask if you don't understand a medical word or instructions. Make sure you feel like you are a part of the shared decision-making process with your healthcare professional and that you feel good about the plan being made. If you have concerns about the plan, speak up. It's okay to disagree. Document what you're being told. Don't be shy about taking notes or have the person who came with you take notes for you. I know that there may be time constraints, but try your best to not end the appointment without fully understanding everything that was discussed. And ask for a copy of your lab work and chart notes, and/or find out how you can access them online if possible. I wish that I could say that as long as you follow these guidelines, you will be able to successfully engage in effective dialogue with your healthcare team 100% of the time. But that would not be true. There is a chance that conflict may occur. For these moments where there may be the possibility of tension and heightened emotions, I recommend checking out this new module created by nephrologists transforming dialysis safety called Let's Reset, a new approach to empower patients to speak up about dialysis safety and prevent infection. Wow, this concept is meant to be used while undergoing in-center hemodialysis. Actually, I believe that the concept can be used in an appointment and hospital setting as well. You can make an agreement with your healthcare team to use the phrase, let's reset, to diffuse emotionally charged conflicts and to facilitate better communication when you feel your concerns aren't being heard or understood. I intend to incorporate this with my healthcare team, even as a transplant recipient. For more complicated situations where conflict resolution isn't enough, seek out a customer service, patient advocate, or patient relations office in the clinic or hospital. Some people find it helpful to work with a professional patient advocate or case manager to make sure their medical needs are being met and their patient rights are being respected. Some hospital systems and patient groups may even be able to provide you with a professional advocate for free or at low cost. I wanted to conclude with a few resources to help you get started in becoming a better self-advocate and increase your health literacy. Please check out the extensive wealth of free knowledge that AAKP offers on our website. And for those of you who are new to this journey and are not quite sure what to ask, AAKP has an excellent pocket guide to managing kidney disease, which contains questions to ask upon receiving diagnosis and throughout CKD stages 1 through 5. Here is also the link to the Let's Reset module, the National Institute of Diabetes and Digestive and Kidney Disease, and the CDC Chronic Kidney Disease Initiative to get you started on your own research gathering. So when you replay my presentation a few times to really soak in all of this information and make notes on how to have effective dialogue with your healthcare team. Right. Take the time to really envision how you would like for you and your healthcare team to communicate with each other. Here's a quote by American women's college basketball head coach, the late Pat Summitt, that can help you define it. Teamwork is really a form of trust. It's what happens when you surrender to the mistaken idea that you can go it alone and realize that you won't achieve your individual goals without the support of your colleagues. If you have any questions or comments, please do not hesitate to reach out to me during the meeting or through email or social media. We are all doing our best to navigate these kidney disease streets together. Again, thank you so much for your attention.
Thank you, Jennifer, for another great presentation. And again, thank you, Dr. Tuttle.